Pulmonary embolism, PEI. Understanding the pathophysiology of pulmonary embolism, PE. 1. Key concept. A blockage of one or more pulmonary arteries by a thrombus, blood clot, or other embolus, fat, air, tumor, leading to impaired blood flow to the lungs. 2. Simplified explanation. Think of PE as a clot in the lungs' blood vessels. 2. A blockage stops blood from getting to the lungs, causing a range of problems. 3. Mnemonic. PEBS. For key aspects of PE, pulmonary artery, blockage of a vessel. Embolus, blood clot, fat air. Blockage of blood flow, sudden onset symptoms. 4. Key features. Embolus, a thrombus, blood clot, or other material that travels from another part of the body, usually the deep veins of the legs or pelvis, and lodges in the pulmonary arteries. Pulmonary artery obstruction. Blockage of blood flow in one or more pulmonary arteries. Increased pulmonary vascular resistance. Obstruction leads to increased pressure in the pulmonary arteries and the right side of the heart. Reduced blood flow to the lungs. Impaired delivery of blood to the alveoli, where gas exchange occurs. Impaired gas exchange. Reduced oxygen levels in the blood, hypoxemia, and often also increased carbon dioxide levels, hypercapnia. 5. Major risk factors. Virchow's triad. Venous stasis. Reduced blood flow in the veins, for example, prolonged immobilization, surgery, obesity, varicose veins. Hypercoagulability. Increased tendency for blood to clot, for example, pregnancy, cancer, inherited clotting disorders, oral contraceptives. Endothelial injury. Damage to the inner lining of the blood vessels, for example, trauma, surgery, IV catheters. Clinical manifestations of pulmonary embolism, PE. 1. Key idea. Symptoms can range from mild to severe and depend on the size and location of the embolus. 2. Mnemonic for PE symptoms, please. Pleuritic chest pain, sharp pain that worsens with breathing. Lightheadedness or dizziness. Excessive shortness of breath, dyspnea, often sudden onset. Anxiety or a sense of impending doom. Syncope, fainting, can occur with a large PE. Elevated respiratory rate, tachypnea, and heart rate, tachycardia. 3. Additional symptoms. Cough may be productive with blood, hemoptysis, sweating. Leg swelling or pain if a DVT is present. Hypoxia, low blood oxygen with decreased oxygen saturation. Hypotension, low blood pressure. A cyanosis, bluish discoloration of the skin due to low oxygen. 4. Important notes. Symptoms may not be specific or present in all cases. Massive PEs cause severe hypotension and signs of shock. 3. Diagnosis of pulmonary embolism, PE. 1. Key idea. Diagnosis requires a high level of suspicion and combination of clinical evaluation and diagnostic testing. 2. Mnemonic for diagnosis. CAP. Clinical assessment, thorough history, physical exam, and assessment of predisposing factors and symptoms. Algorithms and risk scores, such as Wells score or Geneva score, that help determine the likelihood of PE pulmonary angiography, CT pulmonary angiography, CTPA. The most commonly used imaging test to visualize the pulmonary arteries and detect a PE. VQ scan, ventilation perfusion scan, useful when CTPA is not an option. Pulmonary angiography, considered the gold standard, and useful when other tests cannot be used, not commonly done. 3. Additional tests. D-dimer blood test, a blood test to detect the presence of blood clots, but it's not specific for PE. A negative test is helpful in excluding PE, but is not diagnostic for a PE if positive. Electrocardiogram, ECG, may show tachycardia or changes suggestive of right heart strain. Arterial blood gas, ABG, can detect hypoxemia and hypocapnia. Echocardiogram, ultrasound of the heart, may show signs of right heart strain or a thrombus in the right side of the heart. Lower extremity ultrasound to assess for deep vein thrombosis, DVT, which can be a source of a PV. Management of pulmonary embolism, PE. 1. Key idea. Treatment aims to prevent further clot formation, dissolve existing clots, and support the patient. 2. Mnemonic for treatment. ACT. Anticoagulation, the most important initial treatment to prevent the progression and new clot formation, also known as blood thinners. Examples: heparin, unfractionated or low molecular weight; warfarin, factor XA inhibitors, for example rivaroxaban, apixaban, direct thrombin inhibitors, for example dabigatran, clot dissolution, thrombolysis, using medication to dissolve clots in emergency situations for large PEs. Examples: tissue plasminogen activator, TPA, thrombectomy and/or embolectomy, surgical or catheter-based procedures to remove the clot from the pulmonary arteries when thrombolysis is not successful or if it is contraindicated. 3. Additional treatments, supplemental oxygen therapy, hemodynamic support if there is hypotension or shock, IV fluids and vasopressors to raise blood pressure if there is hypotension. Inferior vena cava IVC filter if anticoagulation is contraindicated. 4. Long-term management, anticoagulation therapy, typically for 3-6 months or longer. Management of risk factors and underlying conditions. Potential complications of pulmonary embolism, PE. 1. Mnemonic, PERS. Pulmonary hypertension, elevated blood pressure in the pulmonary arteries. Embolus recurrence, recurrent blood clots in the pulmonary system. Right heart failure, cor pulmonale, due to increased pressure in the pulmonary circulation. Shock, hypotension and circulatory collapse, resulting in multi-organ failure and death. 2. Additional complications, post-thrombotic syndrome, chronic thromboembolic pulmonary hypertension, CTEPH. Death. Simplified explanation. 1. Clot travels to lungs. A blood clot or other material moves from somewhere else in the body, often the legs, to the lungs. 2. Blockage in lungs. The clot blocks a pulmonary artery, disrupting blood flow. 3. Impaired oxygen. Reduced blood flow to the lungs and impaired gas exchange leads to low oxygen levels. 4. Symptoms result: chest pain, shortness of breath, and other symptoms arise. 5. Life-threatening. PE can be a very serious and life-threatening condition, particularly if it's a large clot. Professor Hammer's advice for learning PE. 1. Understand the triad. Be aware of Virchow's triad: stasis, hypercoagulability, and endothelial injury. 2. Know the symptoms. Symptoms such as sudden dyspnea, pleuritic chest pain, and tachypnea are key. 3. Be aware of PE signs such as hypoxia, hypotension, and leg swelling. 4. Recognize the diagnostic approach. Understand that CTPA is the most common imaging modality. 5. Know the treatment. Anticoagulants, clot dissolution, and supportive care are essential. 6. Think seriousness. Be aware that PE is a medical emergency with potentially life-threatening complications. In summary, pulmonary embolism, PE, is a serious condition caused by a blockage of pulmonary arteries, usually by a blood clot. Prompt diagnosis and treatment are critical. The 3 major concepts to understand are the risk factors for the condition, including the risk factors from Virchow's triad, recognizing the clinical symptoms, and the treatment, which may involve anticoagulants, clot-dissolving medication, and procedures.